All right, it's 8:24 now at News Talk 96.5 KPEL, and as promised, this Wednesday edition of Acadiana's Morning News has been quite packed.
It's crazy. I love it. All right, U.S. Senator Bill Cassidy joining us on the line. Sir, good morning.
Hey, good morning. Again, you got a packed news thing, and I'm thinking about avocado tacos. So, I got a better vibe than you guys do.
I got to tell you, it's just the food is that outstanding. It's terrific. Okay, now look, one of my favorite things is food. The second favorite thing is saving money. So I want to talk with you a little bit about this topic. I was very interested in this. Senator Cassidy unveiling some new ideas to make health care affordable again. And, you know, it's sure not like it was even 10 or 15 years ago. Tell me what you're trying to do with this.
Yeah, we're trying to give the patient the power of price, the power of ability to shop, the power of ability to get the best bargain. And folks say you can't get a bargain in health care. You absolutely can. Maybe not a bargain, maybe a fair price. One example, a Consumer Report sent secret shoppers out to look for generic medicines. And they paid cash. Okay, so don't have insurance. This is your cash price. They found that the same medicine could cost $44 in one pharmacy and $700 in another pharmacy.
Wow.
You had no way of knowing except, it paid the medicine. I guess what it goes for. We should allow patients to know the price of a drug so that they can comparatively shop. And if your independent pharmacy has a better price than your chain pharmacy or vice versa, you know it and you go where you get the best price.
Wasn't this kind of menu pricing thing a part of the original thought when we were talking about the Affordable Care Act, was maybe making some of this more transparent? We see that it hasn't happened, obviously, because now all these years later you're still talking about it. And people are paying such a difference. I know there are some areas around here where if you're a cash payer, even without insurance, sometimes they offer like $4 prescriptions. But you would have to know to go there. There's no big sign saying that.
We've got to have the big sign out. We know this works because LASIK surgery, when it first came out, was like $900 an eye with more for astigmatism. That's what it said on the billboard. It's all cash. Now, because it's all cash, it's $395 an eye. And so as the procedure has gotten better, the price has fallen. That's the way it normally happens if you have a market economy. In this case, we don't have a market economy. People are sitting on their price, and the patient is the one who's paying more.
That's wild. Isn't it crazy? I mean, it just is. So is this applicable in other areas of healthcare? Like if you need an MRI, the CAT scan, more applications? And how do we go about making this happen for the patient?
First, it's absolutely more applicable. It isn't if you get in a car wreck and you go to the emergency room. That's where your insurance kicks in, and they have a negotiated price. But right now, people have health savings accounts, or they have $6,000 deductibles on their Obamacare policy, or maybe even their employer's giving them a higher deductible. And so they're paying more and more by cash. So if you can give them a better deal, it works. One example, a woman from Texas stopped me. She'd heard me speak on this. They ordered an MRI for her son's shoulder, so she was going to have to pay $2,000 to $3,000. So she remembers she'd heard me speak about this. So she calls them up and she says, "Okay, what's your cash price?" She gets it down to $647, and then she says, "Wait a second, what if I really paid you cash as opposed to anything else? I mean, when I'm there, I pay you cash. I will give it to you for $497 or something." And so she goes from several thousand down to basically $490.
Because a lot of people, a lot of people don't realize the whole negotiated reimbursement. They think if it costs me $1,000, then my insurance company is going to pay $1,000 too, and that's not how it works.
Not how it works. And the insurance company is actually going to pay a much discounted rate. You don't get that. Going back to drugs, there's something called a point-of-sale rebate, where the insurance company gets the medicine. It's a $1,000 medicine, but they get it for $500. If you're in your deductible, oftentimes you're paying $1,000. You're not getting the discount that has been negotiated by the insurance company. Now, the pharmaceutical company is not getting it, but the payer of the insurance is getting it. But you're paying extra, and they claw that money back from the pharmacy.
Wow.
That's wrong. You're the patient. You got a lot of expensive medicines. you shouldn't be subsidizing the insurance company.
Okay, Senator Cassidy, I have to ask you about this because you've been on the other side of this, and I think it's one of the things that makes you really great to represent us in Congress, because you did have a previous career as a physician, and you're very involved in healthcare because of that. As a doctor, a lot of people don't get to see it from this side of things. You have someone who needs a certain drug that there's no way they can afford it. How does that affect your care?
So usually the healthcare team can get the medicine a patient needs if they cannot afford through things called patient assistance programs. I worked in the charity hospital system, and so as you might guess, I had lots of folks uninsured who needed these programs. Mm-hmm. But what you don't want to do is have somebody get a medicine which is expensive, which shouldn't be. For example, there's a drug called Duexis, and they took ibuprofen, Motrin, and famotidine, which is Pepcid. You can buy Motrin and Pepcid over the counter. They put them together and they marketed it. They charged $2,600 a month for 2 pills, which you could buy a month's supply for $20.
Yeah.
Wow.
So now you may say, well, wait a second. They give me a coupon and I don't really pay that. No, you're paying it through your insurance. Your insurance charges you higher premiums because the insurance pays whatever they pay for a drug, which if you bought over the counter would cost you $20. So we got to distinguish. If you can't afford it, we have ways to get it for you, but we have to make sure that if you can't afford it, it's not because somebody's taken 2 over-the-counter drugs, put them together, and is charging an arm and a leg.
Yeah. No, amen to that, because that's happened to me on a couple of occasions. I have the worst genes in the world, sir. Every bad gene that my parents had, I was the big winner of the lottery. So I've actually had that same situation before where I realized when I looked some things up, I'm like, oh, my goodness.
All this is
this, right?
Wow.
So, yeah, sir, that's certainly a big part of it, and people need to be aware of that.
All right. As we kind of wrap up with Senator Cassidy, I want to ask about this 8-page wish list. It has kind of been circulating around. There's a story in The Advocate listing a lot of these things. What are the top priorities, kind of the first orders of business we really need to do to reform things the way they should be?
So you're speaking about, we put out a white paper, Making Healthcare Affordable Again. It's on our website, cassidy.senate.gov. Price transparency is one we've already discussed.
Yeah.
2, we have to make insurance more affordable. There's actually 2 bills that have been introduced by Republicans and Democrats, and then the Democrats voted against it for partisan purposes. But that could lower premiums by 40% on the individual market. Then we have to begin to look at what is being offered to patients and make sure it brings value. For example, if you knew that you could buy Pepcid for $20 a month, why in the heck would you be spending money on Duexis?
Yeah.
We have to make that evident to people. And next, every now and then there's some bad actor that buys up all the generic versions of a particular drug and raises the price to 800%. So we do what that can't happen. Hey, listen, you just raised the price of a drug 800%. Now my wholesaler can go to France or Germany or England, buy the same medicine and bring it back, no hassle, boom. We now have market forces working to lower drug prices.
Wow. Interesting. Well, U.S. Senator Bill Cassidy, as always, we learn something every time we speak with you. Want to thank you so much for the chance to chat with you, and I think you're also going to be able to be talking to Moon a little bit later this morning. Is that right?
I will be talking to Moon.
All right. Well,
good luck with that. I wouldn't want to have to. I avoid him at all costs in the hallways, but I'm sure it'll be an insightful conversation. Thank you so much, sir.
Have a great day.
Thank you.